Good afternoon, Doctor. My name is EshikaParuchuri, and I'm a sophomore at the Woodbridge Academy Management School. I would like to begin by thanking you for joining me in this initiative. My main objective is to educate adolescents around the world and to help them by constructing a healthier lifestyle through working with experienced doctors across different specializations around the world. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr.Seema.P Dixit, who specializes in neurology. Dr. Dixit has expertise in treating multiple sclerosis, Parkinson's disease, dementia, and more. For this episode, we'll be focusing on brain health and the steps teens can take to have a healthy brain and mind. And now, Dr. Dixit, can you give us a little background regarding your experience in this field?
Sure. Hi, Eshika. Dr.Seema.P Dixit. I'm a neurologist in central New Jersey with Princeton and Rutgers Neurology. And I do specialize in predominantly adult neurology. I see migraines, ADHD, dementia, stroke, seizures, epilepsy, and a wide variety of neurologic conditions. Also, a lot of insomnia and other types of mental health conditions as well.
Very interesting. Okay, so let's dive right into our questions. Could you please explain how important our brain health is?
Well, our brain health is extremely important for longevity. It's important for our day-to-day activities. It's important for us to be productive, to be happy, balanced, and have a healthy lifestyle.
Okay. How does a person know if they are impacted by a neurological condition?
Generally, they'll have signs and symptoms of, it could be headaches, dizziness, loss of vision, trouble with their speech, difficulty moving arms or legs. Most of the time, they'll be referred by their pediatrician or their primary care physician to come and see neurology.
Okay. How does brain development look like in a day-to-day life of teenagers?
Well, teenagers are not quite adults. Their brain is still forming until the age of 24. So, from 13 to 24, they're, trying to get through all their regular school activities, recreational activities, leisure activities. But their brain is still growing. Their development is still growing until the age of 24.
Okay. And what is the top neurological disorder impacting teens based on what you have seen?
I would say sleep-related disorders, not being able to sleep. ADHD is another big component for teenagers. And drugs and alcohol are another big topic for teenagers that leads to other kinds of conditions.
And just curious, but could you elaborate more on exactly how drugs and alcohol affect a teenager's brain, considering that they're not fully developed?
Depending on which drug or alcohol is used, some drugs can be a depressant for the brain, some drugs can be a stimulant, can cause negative side effects, consequences as time goes on, especially using chronically. Also, using a large quantity at one time can be negative. And it can lead to a lot of other conditions as time goes on.
Mhm. How can neurology teach us ways to reduce risks and help the youth navigate this tricky time during adolescence?
I think a priority is basic habits,
Mhm.
getting enough sleep, avoiding large amounts of caffeine, staying away from drugs and alcohol, decreasing screen time, good amounts of socialization with friends and family. I think those are all positive ways that teens can be have a productive, healthy lifestyle.
Mhm. And I know that you've mentioned sleep deprivation earlier. Could you explain how sleep deprivation is leading to neurological problems for teenagers, especially when they're at school or in their day-to-day life?
Well, lack of sleep leads to decreased concentration.
Mhm.
So they may have difficulty performing in school, difficulty performing schoolwork, classwork, outside of school. They could be erroneously diagnosed with ADHD, but it's really sleep deprivation. It can lead to chronic sleep problems as they get older, mood disorders, anxiety, depression, and can also lead to drugs and alcohol because they may feel depressed or down, tired, and they're using medications, drugs and alcohol to help them.
Mhm. Could you tell us the impact of medications on brain health?
Depending on the type of medication, some medications can be beneficial for the brain. For teenagers, it has to be really prescribed by a medical professional if they need the medications, and it should not be abused. Should be taken as prescribed.
Is it important to seek medical advice even if your brain may not have any visible injuries from the outside when involved in an accident?
Yes, any kind of trauma or accident can lead to injuries affecting the brain and should be evaluated. Should not be taken lightly or done by yourself, done by teenagers on their own.
And usually for injuries that might have occurred in accidents where there are no visible injuries, can these injuries be internal and still not show any symptoms?
So head injuries can have a form of a concussion that may not be physically visible to the naked eye, but can result in headaches, dizziness, memory loss, concentration difficulties, irritability, sleep disorders.
Okay. Based on what you have seen, how did the pandemic impact teen brains or just generally, how did it impact the way we think? Did it increase irritability?
Well, during the pandemic, specifically for teenagers and adults, most teens are doing school from home. They're not in the classroom, not around other teens, at least at school. So they are getting that learning component, but it's not as interactive as being in person with teachers and other students. So knowledge base might have been decreased. Also, they're not having that socialization because they're on a screen, so not able to socialize with friends, family as much. So it led to a lot of anxiety and depression. um, for teens as well as adults. Resulted in a lot of medications being prescribed for these conditions. I do think it has improved now with the COVID vaccines and boosters out and new medications for COVID. So I do think that it has much improved, but in some patients, even elderly, it has really caused a decline, potentially in their memory and their overall emotional well-being.
And how important is the social aspect of our lives in the long run?
So it has to be balanced. I think at this day and age, there's a lot of social media and a lot of internet and watching on different modalities: TikTok, Facebook, Instagram, Snapchat, and teens get sucked into that rather than communicating with each other just verbally or in person. And you're looking at pictures or posts that could have some negative impact on others because you're not communicating with them. You're really just looking at posts or pictures. It's not an ideal situation in terms of socialization, and it can lead to anxiety, depression, and ADHD if it's used too much. Also, adult seniors, isolation, being at home by themselves, not being around others can lead to a lot of depression.
Very interesting. How are migraines triggered, and how does it usually impact the quality of life?
So migraines is a different type of entity. Teens and for adults. For teens, it can be very hormonal. Around the menstrual cycle, can run in the family. There's a very strong family presence for migraines for teens and adults. Common triggers are lack of sleep or too much sleep, certain types of foods, gluten, dairy, certain types of alcohol, taking too much Tylenol or Advil over the counter or Excedrin can cause a lot of rebound migraines. The etiology of migraines, there's a couple of different theories. They say that there could be vasodilation of the arteries, sensitization of the neurons around the dura, and an activation of a peptide called CGRP. So these are the mechanisms of action of some of their known migraine medications. But it can afflict many teenagers and adults.
Okay. And now I'd like to talk about ADHD. What is ADHD, and what are some early signs that we should know?
So ADHD is a condition is commonly diagnosed in children and teenagers, but can also be diagnosed in adults. Adult attention deficit hyperactivity disorder. Not everyone has a hyperactivity. Generally, inability to focus, concentrate, stay organized, follow organization, follow protocols, forget to complete tasks, start on a task, not able to finish a task. It can really impact students because it's hard for them to complete schoolwork. They can get behind in school, have poor grades, but are quite intelligent. The hyperactivity is that they can't sit still.
Okay. So it doesn't necessarily inhibit their performance activity, but just
Barely. It's just being able to implement their intelligence in a way that's accepted by society.
Okay, so now that we have talked about ADHD, I'd like to talk about epilepsy. Are teens at risk of developing epilepsy? And what can be some leading factors contributing for epilepsy?
Epilepsy?
Sorry, epilepsy.
Epilepsy are recurrent seizures that have no identifiable cause. Now, in children and teens, it can be idiopathic, meaning that it could be genetic or familial. Is commonly caused by a significant brain injury to the head, a very significant brain trauma where it resulted in stitches or some loss of consciousness, develop seizures afterwards. In adults, it tends to be more common amongst patients who may have had a stroke or a tumor or have changes to their brain. Their brain is shrinking, they're getting older. Alcohol abuse is another big one, and certain medications. So for teenagers, there's a big social stigma for teenagers to have a seizure in classroom or with their friends and being on medications chronically, but it is beneficial and it's going to help them in the long run to stay on medications. A lot of social aspects are going to impact it. Driving, medications they have to take, relationships, getting involved with others, kind of things.
And is epilepsy usually a chronic condition, or can it be
Generally a chronic condition that they need medications for chronically.
Okay. Why are headaches becoming an increasing trend in teens? How are they triggered?
I think a big trigger is lack of sleep. I think a big trigger is screen time. Spending most of their time on a screen or computer or phone most of the day. I think lack of sleep is a big one, trigger as well, and potentially consuming too much caffeine. So caffeine for children or for teenagers really should not be more than probably 1 to 2 caffeinated drinks, like an 8-ounce daily. Now with the advent of these energy drinks, drinking a lot more caffeine to combat not getting enough sleep.
And you've just mentioned energy drinks. How are energy drinks impacting teens? I know that they have a significant amount of caffeine.
I think in small amounts, it could be beneficial to get through a test or an exam or certain amounts of schoolwork, but to take it chronically, it's not necessarily healthy for the brain. The brain is still growing. Really, sleep is the best way to nourish your brain for teenagers, rather than consuming large amounts of caffeine.
Okay, so let's talk about a stroke. What is a stroke, and what are the potential signs and symptoms and even resulting disabilities that can occur due to a stroke?
So a stroke is generally a blood clot or a bleeding that occurs in the brain. Most common causes are high blood pressure, high cholesterol, diabetes, smoking. Can result in a paralysis on one side of the body, loss of vision, loss of speech, difficulty ambulating, can be quite disabling and limiting for patients when they do have it. Stroke prevention is very important. Maintaining a healthy lifestyle, regular exercise, no smoking, not eating fried fatty foods or sugar, carbohydrates. These kind of things will help prevent strokes.
Okay. What are the unique risk factors for women that can lead to a stroke?
Well, women and men are not that different. Women, once they go through menopause, can develop a lot of changes, and hormonally, and that can put them at a higher risk for weight gain and increasing their cholesterol as time goes on, and puts them at a higher risk at that time. So that is necessarily a risk factor, but they have to maintain that.
Okay. What are some foods that we can incorporate into our daily diet to help maintain good brain health?
Good water, hydration, key, at least 2 liters a day, if possible. Limiting caffeine, avoiding sugary drinks like soda, fruit juices. These kind of things can put a lot of calories onto the body and a lot of weight gain. Drinking, your calories. So a high protein diet, consisting of eggs, potentially beans for vegetarians, tofu, chicken, fish. Omega-3s are quite important for brain health. That's found in fish and fish oil. Fruits and vegetables, and low amounts of junk food, sugar, sweets, carbohydrates. That can lead to large amounts of weight gain. It can also make you tired, sluggish, non-productive.
All good foods.
Yeah, junk food for teenagers is a common
Yeah.
common for them to eat that.
What kind of
Small amounts in moderation is important.
small amounts of moderation? And do you believe that there should be a good balance between junk?
Some junk food at certain times of the day may actually help between meals, but you want to have regular healthy meals in between your food.
Okay. What kind of lifestyle factors, like things that we can do during the day, that should be prevented by teens to keep good brain health?
So, adequate amount of sleep. American Academy of Pediatrics recommends 8 to 10 hours for teenagers. I'm sure that's not likely for many, but something around that. Limiting caffeine, having some time during the day where there's some physical activity, whether it's just walking, sports, anything away from the computer or phones for some period of time. Taking breaks during the day and the evenings to avoid some degree of burnout from doing a lot of schoolwork. Taking a walk, going out, with nature, taking your dog for a walk, anything.
Okay. And how does stress affect the risk of getting a stroke?
So stress can increase blood pressure, which is the number one risk factor for stroke. That's the biggest risk factor. Stress also leads to a lot of unhealthy eating. Generally, stress increases cortisol, and cortisol increases the amount of sugar and carbs that we want to eat, leading to weight gain. And that all can lead to a stroke. So, want to find ways to have healthy ways of relieving stress. Getting enough sleep, doing activities that you enjoy, taking breaks from work or schoolwork regularly, socializing with friends and family regularly, in a non social media way.
Okay. How can we tell whether a bump on the head is serious or not?
A bump on the head. So it depends on what you mean by a bump on the head. You mean just hitting your head on the car door,
I
or
guess it can depend. Maybe if the bump hurts.
anything mild where you may have hit your head and you're having some pain that goes away within a few days. Maybe you're icing out.
Mhm.
Can be normal or some type of head injury. Any head injury where you have a loss of consciousness or confusion for any period of time should be seen by a medical professional. Might require some imaging of the brain and some other testing.
Okay.
Any kind of accident or fall where there was some stitches or blood or anything involved should be evaluated.
Okay. Let's talk about concussions. What is a concussion, and what can be some leading causes for concussions to occur in teenagers?
Concussion is generally injury to the brain, very common in teenagers that are participating in athletics, fall injury, ball to the head. There can be some loss of consciousness for a period of time. They should be out of the game for the rest of the day. When it happens, then they should be evaluated by a medical professional. Repeated concussions can lead to dementia at an older age, depending on the type of concussions involved.
Okay. And just to go back to COVID-19 once, did COVID-19 increase the risk of receiving a concussion?
I don't think so. I mean, I think the pandemic and COVID has resulted in people sitting at home more and not being as active, which is not good.
Mm-hmm.
I think your risks for concussion are really any kind of contact sports or head injury or trauma, falls.
Okay. Does the pin and needles feeling point to a pinched nerve?
So it depends on the location of the symptoms and how long it's persistent for. Again, anything that's lasting for days or weeks should be evaluated.
Mm-hmm.
It could be a pinched nerve, but it doesn't necessarily have to be.
Okay. And what are some ways that someone may acquire a pinched nerve?
Most of the time it's in the neck or back, either from a disc, slip disc, fall accident, weight gain is a big cause of it. Actually being quite sedentary can lead to a lot of these issues too. Sitting at your desk all day.
Mm. Okay. So now we will move on to our next segment of the interview, which consists of some common myths related to brain health. Okay. Concussion is strictly a physical injury.
It is not just a physical injury.
Mhm.
It's also can affect your cognition, your mental capacities.
Okay. It's not a concussion if you are not knocked out.
All concussions don't have loss of consciousness. There can be confusion. There can be injury to the head without loss of consciousness.
Interesting. I always assumed that.
Can be a concussion.
I always assumed that it would involve unconsciousness. It's interesting to know.
It depends on the type of concussion. But let's say you're playing a sport and somebody hits you, or you guys collide,
Mm-hmm.
but you didn't you didn't necessarily hit your head or you didn't lose consciousness, but you felt somewhat jolted. That could be a concussion.
Interesting. We only use 10% of our brain.
It's possible, depending on what you're doing. There's different parts of the brain that are used at different times. You have your long-term memory, your short-term memory. So it varies.
Okay. Some people are classified as left brain and some are right brain.
So that can depend on if you're right-handed or left-handed. So if you're right-handed, your left side of your brain is more dominant. If you're left-handed, the right side of your brain is more dominant, and each part of the brain has different functions.
Okay. Does brain size affect intelligence?
Not necessarily.
Okay.
A normal development, normal brain could be a little bit bigger or smaller from person to person, and that doesn't define intelligence. Now, intelligence or IQ can be affected by, let's say you were born developmentally delayed, or you have a smaller brain, then there could be, but not necessarily.
Okay. Brain games improve your memory and reasoning skills.
Yes, this is true. This is true.
Could you suggest some brain games?
Sudoku is a common one that patients do. Anything, crossword puzzles, Scrabble, solitaire, anything can help.
Okay. What have you seen change or evolve in the field of neurology from when you first started to now?
Well, there's been a lot of development. I would say in MS has been a big field that has really progressed. Many more medications than used to be. And the medications are quite effective. So that's one aspect. The other aspect is dementia. There are some new medications for Alzheimer's that we never had before. And testing for Alzheimer's, which is completely new. The third aspect is treatment for migraines. There's a lot of new migraine products out on the market to help teens and adults with migraines.
That's good to know. Could you tell us about a case that you have personally dealt with, which you found to be particularly interesting?
Right. Anything specific or
It could be any topic.
Any topic? So we had a young adult, 28 years old, come in for numbness and tingling of the hands and feet. MRI of the brain showed white matter lesions, questionable, consistent with multiple sclerosis. Patient went for testing, a spinal tap, and found encapsulated organisms in the CSF that questioned if he could have a fungal meningitis. He was admitted to the hospital and had a full workup completed. And further testing showed that he may have a CNS lymphoma versus multiple sclerosis. So he's undergoing more testing to determine which one he has or if he has both, and medications to treat him.
Very interesting. Okay, so now we'll talk about a scenario situation, a hypothetical one. Let's say that we have a scenario in which an individual is facing a stroke with the given symptoms of a drooping face, weak arms, and unclear speech. What can the individuals around do for this person in that moment?
Well, the first thing is to call 911, go to the hospital. Second one is to keep the patient awake, keep talking to them. If you have a blood pressure cuff at home or vitals, you can check their vitals. Wait for the ambulance to come to examine the patient and go to the nearest emergency room. The biggest mistake patients make is that symptoms will go away and they wait to go to the hospital. You wait to go to the hospital, you may not be eligible for medication that could be a clot buster and reverse your stroke symptoms. That's within the first 4 to 6 hours of symptoms.
Mhm.
And if you wait longer, it could result in more adverse outcomes.
Okay. And do you have any advice for future healthcare workers?
For future healthcare workers, it can be a grueling job, a lot of hours, a lot asked of you, but you're helping your community and your public, and you're providing a service that's selfless, but will certainly help others in the future.
That's good advice. And with that, our podcast session has now come to a conclusion. I would like to thank you once again for your time, input, and contribution. And for our listeners,
Nourish your habits to flourish your lifestyle.
thank you, Doctor.
Thank you, Eshika. Appreciate your time.